Hi, my name is Saif Gallagher. I am a plastic and reconstructive surgeon based in Indianapolis, Indiana. And in this video, I'm going to talk about comfort after vaginoplasty. So, overall, the first thing to say is this sort of surgery tends not to be too painful. Of all the things we do to patients, often times it can be surprisingly not too bad. Most of our patients will rank their pain on the first and second day about an average of 4 out of 10, but there's certainly some things we can do to help with comfort after surgery. So we'll talk about what happens immediately after surgery and kind of follow out to the weeks afterwards, and what can be done to help with pain, so you have a better surgical experience around the time of your vaginoplasty. So the first thing, or maybe change, I made in my practice was with the dressing. So the old way of doing the dressing, and a lot of surgeons still do this, is to sew on the dressing, which is fine when you're still in bed, but when patients begin to move around, it can pull a little bit and it can be difficult. So we do need what's called a pressure dressing, because we want the dressing to help prevent any bleeding from the outside parts that are trying to heal after your surgery. But there again, we don't want too much dressing. So usually as soon as the patient's awake enough, that's one of the first things I'll do is go check on them in the recovery area and just make sure that there's no part of the dressing that's catching that we can adjust. So that will be the first thing. So just a quick word on pain meds after surgery. We all know opiates have gotten a pretty bad reputation, and really, not... I don't disagree with that. It is always advisable to try and get your patients onto other medications and alternatives to opiates as soon as possible. Opiates have a lot of side effects, and most important of which would be nausea, maybe constipation, and it is favorable to get your patients off them within reason as soon as possible. Ways we can do that is, firstly, we use what's called a nerve block. So a nerve block just basically means using one of those medications that have very few side effects that dentists famously use. So it's something in the family of Novocaine. The actual medication we've evolved to start using is a very nice drug called Exparel. So Exparel is just a really long-acting version of a drug in this family, and it can last up to 72 hours. And we have had some girls who've had an excellent response to it, in that we haven't had to give them any narcotics at all. They just simply didn't need it afterwards. However, pain is a very personal experience. It's a little bit unpredictable how exactly your body is going to react to the different medications. So I would say still the vast majority of our patients do require some narcotics. So another thing that can bother patients a lot in the days after surgery is what we call bladder spasm. So one of the necessary evils of vaginoplasty is we do have to place that catheter in the bladder in order to allow everything to heal. And sometimes that can irritate your bladder and give you the sense that you have to urinate. In the vast majority of times, we're able to just reassure the patient and remind them that they may feel like they're going to wet themselves, but they certainly aren't, that the catheter is going to do the job and they can just relax. And usually in the vast majority of patients, this feeling will pass pretty soon. In patients where it doesn't pass, we can give some other types of medications that help with bladder spasm as well. So in the days and weeks following surgery, when you're back at home, most patients will require some of those narcotic medications by mouth, and eventually at about 1 to 2 weeks time, we'll phase them out, maybe just using them at night to make sure they can sleep through the night, but substituting in other medications that have fewer side effects, such as Tylenol or ibuprofen. Another tip that our patients give us is that certainly there will be good days and bad days. Your recovery after surgery isn't a straight line. It's not a linear progression. Unfortunately, it can be a little bit all over the place, but in general, obviously, you're going to progress in the right direction. And so for those days where you have maybe a little bit more swelling than usual, and dilation can really seem like a drag. Some of our patients have recommended popping the dilators in the fridge for a little while, and this can feel good and relaxing when you go to use them. Obviously, have to use common sense here. Don't freeze them because you can actually get frostbite. It is a possibility if you're to put something at a very low temperature against your new vagina. So those are just some things we found helpful for patients to help improve a patient's experience after vaginoplasty. Overall, compared to a lot of different surgeries we do, this is, however, not one of the more painful surgeries.